I find often with recommendations to families, depending, of course, on which disease we're speaking of, but that oftentimes it's education. So I think families sometimes are unsure exactly which path to take. And so I do a lot of that in my visits. I do a lot of patient and family education. I give handouts so that not only in the visit are you getting education, but you also have something to take home. Because I know oftentimes myself with my own children, I'll say, oh, what did that doctor say? I don't remember that. So it's nice to have something written down so that you can actually, focus back on that and say, oh yes, this is what they meant, or this is what we need to be focusing on. And then the other piece I always say to my patients is that if there are any questions that come up afterwards, then just give me a call. I'm always available after the visit. So, this is a relationship with the family and the patient that continues even after the visit. It's not something that ends once you leave the office. And so I always stress that they're able to call me at any time if something comes up. I became a doctor, one, because I loved science as a child. I loved biology, and that's always where I kind of had my focus and tended to always, was always driven towards. Those are the types of things that I loved. Then I was able to do an experience in high school where you got to shadow a doctor, you got to see their experience. And interestingly, there were some physicians who said, don't go into medicine. This is not the field that I would recommend you choose. And then the opposite. There were some that loved it. And after all of that information, I said, this is exactly what I want to do. And so it was very early, but I knew that this was the passion that I had. And then same thing, through college, it was just reinforced. And then once I was in medical school, I said, yes, I love being able to interact with people. I feel like I'm a people person. And I love being able to help patients' diseases, their health care, because health is really something that oversees every aspect of your life. If you're not healthy, especially children, they don't have the opportunity to follow their dreams and their goals and their aspirations. So I love the fact that I'm able to play a role there and help in terms of their health, and then really then the only focus is just being a kid. So we're new to the Chattanooga area. I'm originally from the East Coast. So number one, love the weather. So I love that it's November and there's no snow on the ground and I don't have to wear gloves yet, that kind of thing. So that's something I love. And then the other piece is, and I find this over and over again, is that people in Chattanooga are so welcoming. They are so nice. Everyone is always asking if there's something that they can do to help. We've just found really, really great people in the area that really are just very, very nice people. So I love that. And then, of course, all the family things to do. So having children and being a pediatrician, love the fact that there is so many family-oriented activities here. Endocrinology really expands a vast number of diagnoses. So not only do we take care of diabetes, but anything in terms of hormone systems. So growth issues, thyroid problems, anything with our adrenal glands, puberty. And so there's a huge variety in pediatric endocrinology. And I think that's also one of the reasons why I chose to do pediatric endocrinology, is I love that there are lots of different areas to focus on. So, a referral to a pediatric endocrinologist typically comes from the pediatrician. And so the pediatrician is the number one person to say, there may be something going on here that you need to see a pediatric endocrinologist. Typically, it would be if there are issues with growth or with thyroid problems, and then, of course, if there are any signs or symptoms of diabetes. So some signs and symptoms of diabetes would be an increased thirst and increased urination, especially overnight, weight loss that's unintentional, sometimes abdominal pain and nausea, vomiting, things of that nature. Certainly, seek your pediatrician's help, and then they can certainly refer you to me if need be. And then issues with growth and thyroid. In children, the biggest thing is typically problems in terms of height growth. So oftentimes, you're saying as a parent, I just haven't changed their pant size in a year. I don't see them growing. Normally every school year we're buying new size pants. They're getting short, but we're not seeing that this year. We're not seeing that after the last couple years. And that's a good indicator that your child's probably not growing in terms of their height. Oftentimes then it seems like their weight is they're a little bit overweight for their height. And typically it's not a weight issue, it's just that they're not growing in height, so they look a little bit overweight for their height. And those are sometimes some of the things that a pediatrician would be able to take a look at as well. So we also see patients with issues with puberty, either early or late. And certainly every patient goes through and every child goes through puberty at different times. Even if as a mom you went through puberty at the age of 12, it doesn't necessarily mean that your child will follow suit. And so the best thing to do is have the pediatrician evaluate. Typically pediatricians are able to evaluate puberty at every well child checked. Those are what those are for. And then as a concern, if as a parent you have a concern, certainly talk to the pediatrician. And if they see that something may be abnormal, then that would be a great time to see the pediatric endocrinologist.